సో శాలిని, ఐవీఎఫ్ కి రైట్ ఏజ్ ఏంటి, లేదా సక్సెస్ రేట్ ఏంటి, ఇలాంటి చాలా క్వశ్చన్స్ ఉంటాయి. సో కొంచెం కెన్ యూ ప్లీజ్ క్లారిఫై ఆల్ దోస్ డౌట్స్?
So first of all, there is no age for IVF. There are indications for IVF. Many people think that only elder women go for IVF. Are they completely wrong? If there is an indication, you may have to go for IVF at an early age, maybe in your 20s. There are patients who attain premature menopause, means they don't have eggs in their ovary. They are the candidates for IVF. So there is no correct age, but you need to have a right indication. As I've already told, if your egg number is very low, if your sperm count is very low, if your uterus has a problem, there is endometriosis, or if your fallopian tubes are blocked, there are the few indications where women might need IVF. So don't wait to go at a particular age to go for IVF.
Okay.
But find the right indication for IVF.
Oh, okay. So how do you deal with the uncertainty of the process? అంటే వాళ్ళ మెంటల్ కండిషన్ కూడా, నేను ఐవీఎఫ్ తీసుకోవాల్సి వస్తుంది, నాకు పిల్లలు లేరు. సో ఈ ఎమోషనల్ థింగ్స్, హౌ డూ హ్యాండిల్ విత్ ఆల్ దీస్ థింగ్స్?
See, IVF ఇప్పుడు చాలా టాబూస్ ఉన్నాయి నా సొసైటీలో. ఇది ఐవీఎఫ్ బేబీ చాలా అబ్నార్మల్, అది బెడ్ రెస్ట్ చేయాలి, అదే దీస్ ఆర్ ఆల్ మిత్స్. టుడే ఐవీఎఫ్ సైన్స్ హ్యాస్ అడ్వాన్స్డ్ సో మచ్ దట్ women don't need to take bed rest. Babies are completely normal,
healthy.
Yeah, and it is a daycare procedure. You don't need to get admitted to hospital, miss your working day. You can continue to do work at your home.
Okay.
So IVF is a very advanced technique, has a very good success rate. So if you have indication for IVF, don't think what others will say.
Yes, agree.
If you need it, you need to go for it and plan pregnancy as soon as possible. Because you want to know why? Because as the age of the female increases, success rate of IVF will reduce.
Okay.
So if you have indication for IVF and you need to do IVF, don't delay it unnecessarily. Do it right now, you will get success. But if you do the same procedure after 2 years, your success will reduce. So success of IVF depends upon age of the female, of the couple. So don't delay it. Just go for it and get the baby in your hand.
So you're saying it is very normal to take IVF?
Yes, just like you take any other treatment. If you have a kidney issue, you will take an issue. So fertility is also a disease. It should be treated on time with correct method. If you are taking a wrong treatment for a wrong indication, then you will not get success and you will just delay your pregnancy. So take the right treatment, make the right diagnosis and get treated. So don't make it at a a taboo. Let's normalize IVF. Let's not think that it's something abnormal. So as a society, we should encourage women to go and get the treatment what they need, not what their families thinks, what the society thinks. So this taboo has to be removed and IVF has to be normalized.
Okay, you have put it out in a wonderful way. That's because so many have this same question, like what other people are saying, what my baby being treated outside. So that's a wonderful answer, I would say, that you have clarified right now. So what are the suggestions that you are going to give it to women who are above 40 years old?
So first of all, what I will suggest is, if you are above 40 and you are thinking about pregnancy, you're already delayed it too much.
Okay.
Right? Because your biological clock is continuing to tickle.
Okay.
Right? So you're not going to reverse your age. So first of all, women above 40 have very few eggs in their ovary, and the quality of eggs is also reduced. So if you're fortunate enough to have eggs in your ovary, then you can plan IVF with your own eggs. But if you are unfortunate and the eggs are of not very good quality or they are not enough, then sometimes you might have to go for donor IVF, where you take eggs from a donor. A younger woman donates eggs. It is fertilized with husband's sperm and put it inside your uterus. The baby will be yours, and it is a legal procedure.
Okay.
And there is no shame in going for this procedure. But as I said earlier, the better. So if you want to plan pregnancy after 40, please consult your doctor to look out for various options.
Okay. So right now we have talked about the women of above 40. So you want to say something to the men above 40, how to take care of everything or something like that?
So if you're a couple above 40, men will produce sperms.
Okay.
We should understand the basic difference between men and women. Women have a limited reproductive age.
Okay.
Men produce new sperms every 3 months. So men can father children above 40. But for women, it is very difficult to produce eggs above 40. So if a man is going for IVF, the success depends upon the female's age, not the male age. So female age is very important. So as a woman, I want you to understand that your age is contributing to the success or failure of your treatment. So you have to hurry up the things, not wait for you to get over 40.
Okay. That's wonderful.